Breaking news, my name is Cassandra Rodriguez, live on JCLR News. There has been a report on the crisis in Morocco. Morocco's healthcare is currently in distress. Public hospitals are lacking doctors, equipment, and medicine. Fewer than 30% of Moroccans have health insurance coverage. The Moroccan government spends more than $5 billion a year on health care. It has allocated 3.2% on its budget to healthcare this year, according to the Finance 2013 budget documents. After, we have a story on imperialism. Imperialism is a policy of extending a country's power and influence through diplomacy or military force. First, we have a story on Rafael Rangel, a great descendant of a Moroccan citizen, telling us about his great-grandfather's time in Morocco's imperialism.
My name is Rafael Rangel, and my great-grandfather, Kumalo Rangel, lived in Morocco during imperialism.
How long did he live there?
He lived there from 1900 to 1920.
Did he receive any kind of health care?
He did receive healthcare, but it was very poor healthcare until the Belgian government overtook Morocco and made the healthcare better and made medical advancements.
What kind of advancements were there?
The medical advancements went from vaccines to medications, and in the medications including aspirin and painkillers. They also began to sterilize all their medical instruments in the hospital, that way diseases wouldn't spread inside the hospital.
What were some of the common diseases?
Well, there are many diseases, but one of the most common diseases was rinderpest, and rinderpest was a disease that spread from animals.
How did they cure rinderpest?
There was no cure to rinderpest. They tried using medications and herbal treatments, but they mostly all ended up dead because of rinderpest.
Well, there you have it.
Here we have another story of the archaeologists who have detected great clues of the health infrastructure of Morocco before colonization. Here are some of the images of the artifacts they discovered.
Okay, thank you, Cassie. As you guys can see, we're uncovering great treasures from the past. We've come across great artifacts that depict the health infrastructure even before colonization began in Morocco. So, the people in Morocco back then were the Berbers. They were a nomadic group of people that lived in northern Africa, but then they were changed to Islam when they were conquered, but they still kept their cultural and religion.
Luis, check this out. We did this ancient book talking about medicine. Can you take a look at this?
This is gargantuous! This is a book from a apothecary.
What is that?
Well, an apothecary is a person who gives out illegally drugs and or medicine. Well, as of now, back then it was popular. But anyways, the apothecaries, they use cayenne pepper to overall strengthen the immune system, fight bacteria, and reduce fever. They also use ginger to help digest.
Oh, so they use a lot of herbal medicine, right? Can you explain these fossils that we picked up earlier?
Oh yes, the Berbers use animals such as tortoise, lizards, and everything for their beliefs that help strengthen why people wanted to take these medicines. But later on, it was concluded that it was witchcraft. But look, tortoise blood was used to help improve the immune system and all that, and even chameleons were used.
What about plants? I'm pretty sure you use plants, right?
Yes, plants were actually the foundation of medicine. Medicinal plants were used traditionally to treat colds, flus, coughs, wounds, cuts, rashes, diarrhea, and even fevers. The most common plant was the Fabaceae from the Fabaceae family, and not only were they medicinal plants for humans, but for livestock as well.
Oh, interesting. So it seems like the healthcare infrastructure was fine in Morocco back then.
I don't think so, Joel. As time progresses, the humans, we evolve, we improve our ways, and unfortunately, there was a plague bit worse than the Black Death, and it was spreading all throughout northern Africa, causing Morocco to actually get help from other countries that eventually conquered it.
So, do you have any idea what the doctor-to-patient ratio was?
No, sadly, I do not know. There is not enough research to conclude the patient-to-doctor ratio.
So, was everyone getting a chance to this kind of healthcare?
At first, I do believe so, since apothecary had gained popularity, but as time later evolved, the highest and most popular apothecary was only used for tribal leaders.
Well, I guess we're done here.
Back to you, Cassie.
That concludes our news report. I am Cassandra Rodriguez, and you're watching JCLR News.